Well, even with the new healthcare reform, is now the time to start looking at natural treatments when it comes to common health problems. Joining us this morning to talk about those natural treatments is Dr. James Krystosik, along with one of his patients, Bonnie Bobrowski, who is a patient at the Solon Health Recovery Center. Thank you so much for coming on the show.
Thank you.
Doctor, first off, you're a part of a large body of physicians that believe that when it comes to conventional medicine, people are actually being diagnosed and treated wrongly, I guess, for the lack of a better term. What is happening, and why do you feel that way?
Well, people across the country are looking for answers for healthcare problems, and physicians like myself who practice natural medicine, evidence-based natural medicine, these are medical doctors and chiropractors like myself and osteopaths. We feel and we think that the conventional practitioners are looking at disease in the wrong way, and they're looking at it on a false premise based on the idea that people get sick because of bad genes, bad germs, and bad luck. And Michael, that's just bad science, because the latest research demonstrates that it's bad choices. That's the reason people get sick.
Now, Bonnie, what was your health problem that made you decide to go the natural treatment route?
Well, I was pretty healthy, but about 3 months ago, I got really sick, and I had pain all over my body, especially joint pain in my hands and my fingers, and so I went to my orthopedic doctor, and he had blood tests taken. The blood test showed that I would probably have rheumatoid arthritis or lupus, and that I should see a rheumatologist. So I heard about Dr. Krystosik, and I decided I've never really liked to take medications, and I didn't want to be on that track if I didn't have to. So I went to Dr. Krystosik, and within a month the symptoms were gone, my pain was gone, and I feel great today. So
what did this doctor do that the other doctors didn't do?
Well, he was looking for the cause, what caused this to happen, and we discovered, I had this autoimmune problem, and that my system was being affected maybe by the foods that I ate. So we had allergy tests taken, and was my nutrition strong enough, to withstand the things that were coming against my body? So there was nutrition typing tests that I went through, and chiropractic manipulation to get my skeletal body in order. And so I feel like he put my whole body in good balance so I can fight off the things that would come against me.
So, doctor, how do you diagnose someone who comes into your office? Bonnie just explained how you diagnosed her, but is it common with all patients, or is each patient different on how you actually diagnose and treat the problem?
Well, just like no two people are alike, they may have the same symptoms, but the way we look at and treat them is different for each person. So we personalize a treatment plan according to that person's biochemical needs. And so what we did is we did a food allergy blood test for her to determine the foods that were actually not good for her, that were causing immune system reactions. And number two, we did a vitamin test to see what she was deficient in. We tested for 32 different nutrients, and we found that she was deficient in several nutrients. And once again, we customized it for her particular body chemistry. And each person that has different symptoms are going to get a different treatment plan.
Is it, correct me if I'm wrong, but I mean, there might be something that she's eating that she might think is healthy for her, but in actuality, exactly, it's actually doing her more harm than good.
Exactly.
Now, that goes along the lines of obesity. Obesity's out of control. People are eating things and it's just ruining their body. Can people lose weight, through your treatments?
Well, we tell people that I don't focus on people getting to lose weight. We tell people, if you want to lose weight, look at getting healthy. Focus on that. And when you get healthy, the weight will come off automatically, just like the patient you'll see here in a minute who lost over 90 pounds, and she had tried several diets and they all failed. And she was also unhealthy when she came to our office. But we personalized the diet for her.
Okay, well, as you mentioned, doctor, we actually have a quick testimony from one of your patients that we want to take a look at.
I would recommend Dr. Krystosik to anyone who wants to lose weight, who wants to feel better, feel healthy. You owe it to yourself.
And that's a great way to finish this segment. Bonnie, thank you so much. I'm so glad you're feeling better.
Thank you, Michael.
You hopped right up here with
Very
no pain
grateful.
whatsoever. Doctor, thank you very much
pleasure.
for coming on the show.
Thanks.
If you want to contact Dr. James Krystosik at the Solon Health Recovery Center, you can do so by going to their website, solonhealthrecovery.com, or go to 440-519-1766 for more information. Thank you again. Well, coming up on Good Company today, LifeBank's here. We're going to be talking about how you can actually become an organ donor. And we are continuing to give away IX Indoor Amusement Park tickets. We'll be right back with more Good Company.
This segment of Good Company was paid for by the Solon Health Recovery Center.